A recommendation, what I believe is truly important for any kind of telemedical program is, first of all, the kind of availability and the goodwill to really try to help and solve a solution in a given area. Maybe some technologies, even if it's missing, could be overcome then. And what I believe is very crucial is also that the nurses and maybe sometimes lower level, I would say not correctly, lower level thought personnel is involved, and that because very often these people are so crucial. And in programs that, for example, we run in Brazil, it's about nurses, and eventually the doctor himself naturally he oversees, but it is the nurse who is in the contact and who is the operative there.
Specific to Brazil.
But I believe it's everywhere. It's because very often telemedicine helps, so that since you would like to improve the let's say the availability of the given healthcare service, you need to do it through someone, and it's not always the doctor, because the doctor is always limited. You always work in regions when there is too few doctors for too many people, and so that's why you must be ready to work in a way that also maybe less trained people can actually provide the service in a way that, for example, they do just the measurement.
Do you find that sometimes doctors are reluctant when it comes to telemedicine? They assume that my patients might be maybe missing my patient.
That's true, and I think some of them would like to see their patients as much as possible. Mm-hmm. In the meantime, telemedicine doesn't mean that you see less your patient, but you see your patient in time, in the right time, because very often you miss the opportunity as a doctor or as a patient to do some treatment which could have been done if you knew the information just maybe a year ago. And I think telemedicine helps so that you can see that and have this opportunity.
So can we say that telemedicine we can say that telemedicine starts with a Skype call, going till gamification and continuously care management?
Well, telemedicine, I think for me at least, is everything. Where you, for example, even do a measurement. Just take an example. You are in a place somewhere where there is no expert doctor, and you suffer from diabetes. And for example, what might happen is that you are even not aware that your vascular system is at risk, your eyes are at risk, your kidneys are at risk, or these are secondary effects. But if, let's say, at this place, there is a measuring point where you know that which you attend regularly, which is easy for you. So you can send the data, and some kind of center can evaluate and come back, and if there is any issue, you can be warned in time. And I think this, I believe, is very important. Naturally, Skype and all other things are great for the communication, so that you can see each face to face. But let's say having the information in time is crucial, and this is, I think, which is great about telemedicine.
So I have a final one question. It's going to be very specific when it comes to the security and the privacy of the patients, and how do you take care of chronic disease management using telemedicine as per your experience?
So I can say that almost all of our patients suffer from diabetes and or other chronic disease, basically we are mostly focused on the perfusion, because let's say blood and the way how blood flows through your body is the key let's say indicator of your health. And here I believe that it is telemedicine is very important for the chronic disease management, because it actually helps not only to let's say improve the data about the patient, so not only the early diagnostics, but also the monitoring and let's say improvement of the therapy, because when you take a medicament, well, there are general prescriptions, but if you have a real-time data and you can adapt and personalize how to do that, it's much more important. It also opens the way so that you can work as a family. We can have the data from the family and even improve, not only for yourself, but also for let's say those with whom you are connected. And the third part is that it also helps to connect that, for example, in Europe, diabetologists, cardiologists, and angiologists, so let's say three different branches of the medical science, do not cooperate that much. The great advantage, I think, of rural areas is that you have to work together, because you just think about one health and one life in a sense. So.
Thank you very much.
Okay.
Thanks for your time.
No, thank you.
Thank you. So, see you there.
See you.